Good morning and aloha. I'm Professor Al Shimkus, and the topic for this presentation is health security in the Asia Pacific. As national security professionals now focused upon the Asia Pacific, you've heard many plenaries and panels and reflected upon those presentations and dialogued what you heard in the plenaries. This particular plenary will be about health security in the Asia Pacific. But before we go into the context of this particular session, what I would like you to do is think about your health security and how COVID-19 has impacted you as a person serving your country, and you as a husband or wife and your family. And from a personal perspective, I did not really concern myself with my health security after serving 39 years in uniform, being a civilian faculty member at another postgraduate institution, and then finally coming to Hawaii at APCSS. My health security was kind of a given. And I think the nature of our current environment in relation to health security is an important component of what you need to be thinking about as we move through some of the key areas of interest that I have put together in this presentation. So as an overview of the health security in the Pacific, I would like to say to you that this is the definition of the World Health Organization. The activities required, both proactive and reactive, to minimize the danger and impact of acute health events that endanger the health and well-being of people. So to reflect on where we've been with relationship to health security, the emergence and spread of new infectious diseases can threaten health security, particularly those diseases that can be transmitted between people. And the examples we have are the SARS, which is 2002 to 2003, which really impacted economically about a $40 billion loss across the globe. Another one was the H1N1 influenza in 2009, 8,000 deaths, and over 214 countries. Ebola in 2014 to 2015 in West Africa. Interesting perspective on Ebola from a public health perspective. When the borders were closed for the Ebola outbreak, the spread of the outbreak of Ebola almost ceased. Of course, we had significant input to the region from across the world, but the closing of the borders, which is similar to a lockdown, no travel, really tamped down the Ebola spread. The other element that we're dealing with at the moment is COVID-19, and when you think about how this has impacted your health security from maybe February through today at towards the end of November, think about health security in the context of what this means for you as a national security practitioner, focusing on the Asia Pacific arena and how health security impacts how we manage this arena of interest and significance to our country. And so what I will do is to outline some very broad brush perspectives about how health security impacts the region. And so why does health security matter? As the global population, international travel and trade have increased, the risk of emerging and rapid international spread of infectious disease has become a major international concern. If we reflect back, 1918, 1920 flu, it affected 500 million people. And it is estimated that 5% of the world population died during this period of time. So I think health security has always been a factor within the context of our national security agenda. But this situation in the flu of 1918 to 1920 was kind of forgotten and put into the past. And now that we're enduring the COVID pandemic of 2020, I think it comes to bear that health security does matter. The socioeconomics of health security are also important. Infectious disease outbreaks have a range of negative social, economic, and political consequences. The social impacts of infectious disease outbreaks include interruption of education, reduced community functioning, stigma, discrimination, total social instability, widespread job losses, along with food insecurity. I think when we put this in context of what has happened to the United States and then what has happened throughout Asia Pacific, the impact is extraordinary and really yet to be determined, but the real significant economic impact was on the population of this region. To reflect on a personal level, how has education in your family been changed based on the nature of secondary and postgraduate education? Our children and grandchildren are working their schooling from home. Some are in a blended environment in which they go to school some days and go to virtual the other days. But it certainly had an impact on how we function as a family. The other element here is that based on what IPOC 20-1 has meant to the center and to you, we have 5 separate seminars coming in on 5 separate days to work in a seminar session physically, and the other 4 days are worked in a virtual component. So what this means for future courses and what this means for us as educators is yet to be determined. But the nature of our process when you came into the APCSS, temperature taking, question answering, it's about accountability and it's about responsibility to protect yourself, but also to protect others. So mask wearing, hand washing, etc. is very, very important. And who would have thought we would be doing this intrusive component of protection in December of 2019? An analogy might be, who would have thought we'd endure the TSA process before 9/11? But I think it'll become the norm, and it'll be something that we will endure probably for the next 2 to 5 years. So you heard earlier about gender, and gender really is a component of health security that can affect males and females differently as a result of sex differences and gender inequalities. Gender differences are shaped by socio-cultural factors and differences in access to and control over resources. A 2016 UN Global Health Crisis Task Force reported, experience has consistently shown that health crises have a particular and important effect along gender lines. Understanding and pay attention to the potential gendered impacts of an outbreak is critical to responding effectively. And I think we see examples of this in the Indo-Pacific region, and we'll talk more about that in a few minutes. So health security and the invisibility of women. Planners and operation managers can ignore to fail to take actions to address the consequences of emergencies for women. In health emergencies, women are often more vulnerable to economic hardship as a result of inequitable access to resources and may face a relatively greater economic hardship. An example of this is when women are self-employed in small volume trading across borders. This is significant in the context of when the borders are closed or movement is restricted, there is a significant effect on their self-employed business. So this is one of the minor examples, major to the people who are affected, but how the invisibility of women needs to be taken into consideration when we think about health security and gender. Another element of our concern, the question I would ask, and maybe you can discuss this in our discussion area or in seminar, is that do borders protect against infectious disease? Does sovereign borders affect how a disease is spread? There are certainly sovereignty issues with regard to borders, but disease in the context of transmission of disease, borders, we are finding, make no difference. So that's one of the things in the national security context that you should be considering. So I have made 5 different arenas here that I'm going to be talking about in the Indo-Pacific: demographics, economic development, vulnerable healthcare systems, food systems, and briefly climate change. Indo-Pacific health security demographics. Population growth is relatively low in Indo-Pacific. However, an aging population is a key structural factor. An aging population is not a driver of health security threats, but older people may be at risk of severe outcomes due to infectious disease outbreaks. And migration is a growing trend in the region. The majority move to neighboring countries or within the same region. Malaysia, Singapore, and Thailand are the key migrant hubs with the associated risk of pathogen spread. Also, another factor within Asia Pacific is that the fertility rate is decreasing and life expectancy is increasing. And the political factors associated here are if we have a government that is relatively stable, that increases the possibility of health security being in better shape, or if there is conflict or instability or weak governance, that means generally from a public health perspective that health security diminishes. Myanmar is an example of this, with years of instability and ethnic tensions across the region. So health security in Myanmar is reduced. Indo-Pacific security and economic development. I know you heard a plenary earlier about the economies of this region, but extensive trade and travel links bolstered by economic growth amplify the risk of spread of diseases like airplane travel, etc. For example, tourists arriving to Fiji from China, Hong Kong, India, Japan, and South Korea, and the rest of Asia nearly doubled from 2014 to 2018. Over half of these arrivals were from China. And it's interesting, in the paper this morning, today is the 29th of October, we're going to open up travel from Japan quickly. And what does that mean about the nature of how Hawaii, Oahu in particular, has tried to control the virus? So it is very important for us to consider the economic development and the trade with regard to the spread of a pandemic-like environment. The other element that is important for us to consider is vulnerable healthcare systems. Healthcare systems are a major concern in the face of infectious disease threats. Shortage of specific personnel and skill sets, recruitment problems, retention, and an aging workforce are factors, as is inadequate access to education and training opportunities. And institutional capacity and financial constraints also lead to less than quality care. And weak governance. If we have a weak governance in the context of oversight into healthcare facilities, there's a arena of a vulnerable healthcare system based on weak governance. Food systems is something I'd like to spend a few minutes talking about. And at various points in the food system, there is a potential for infectious pathogens to give rise to zoonotic diseases to threaten food security. A zoonotic disease is a disease that is caused by a pathogen that has jumped from animal to human, possibly similar to the situation we're dealing with COVID. There is also a potential for poor nutrition to increase susceptibility to infectious disease, which the individual themselves, if they don't have good nutrition, could be more susceptible to a disease process. Food security, which includes production, processing, supply, preparation, and consumption. So unless there's a robust oversight of all these factors, the likelihood of being and eating food contamination is reasonably good. So climate change is another factor that you'll be hearing about in the next plenary, but I just wanted to touch upon it with regard to health security. Climate change is likely to have a substantial and far-reaching impact on human and animal health in the region. Countries in the Indo-Pacific are among the most affected by climate change. Pacific Island countries are most vulnerable to the effects of sea rise, extreme weather events, and some may threaten the very existence of these low-lying nations. The Maldives, the Marshall Islands, Tuvalu, and Kiribati are those that are really mostly affected. And if the sea continues to rise, migration is part of that, and so vulnerability to infectious disease as far as health security is significantly increased. So what is happening and what can be done? There were three basic principles in public health that I will discuss briefly, and that is prevent, detect, and respond. So to prevent is the implementation of core capabilities in human and animal health requires multiple, multi-sectional and multidisciplinary national partnerships that support efficient and alert response systems. And I've given a few examples here. Fiji self-assessed at 100%, Papua New Guinea and Samoa self-assessed at 70 to 80%, and Myanmar, Timor-Leste, and Vietnam scored lower. So what this means is those countries maybe have a less opportunity to prevent the spread of an infectious disease. A zoonotic disease, the ability to prevent zoonotic disease remains poor. Self-reporting countries indicate their capacity to treat is only 20%. Think about a sick animal who is an important component of the economic well-being of a particular family, and also may be used for food source, and that animal becomes sick. If there is not enough veterinary support in that particular region, it may be that animals become sick. They're no longer an economic source of well-being, and certainly the food that they would produce would be diminished considerably. So the answer to this question is sometimes increased veterinary science, vet techs, and so forth. But right now, the nature of animal health as it affects human health is significant and important for us to consider as we engage in these arenas of public health with our partner nations. The other element is prevent. The World Health Organization estimates that 1 in 10 people will become ill from eating contaminated food every year, and this relates back to that source that I spoke about earlier, and that 420,000 people will die as a result. So those countries listed below are, from the World Health perspective, unable to protect people from eating contaminated food. So in our Western societies here, we have a rigorous process by which food is examined prior to putting it into the market. In our developing countries in this region, that is not the case. So to continue to detect and prevent, early detection of outbreaks is necessary to control the spread of infectious diseases. Unfortunately, laboratory capacity within the region is highly variable, and laboratory capacity is limited in many countries. So training programs may work to help reduce this need. So respond. Achieving core capabilities to respond to health threats is critical to minimize health, social, and economic losses. There is considerable variation in preparedness with response to regions. One is Indonesia, Vietnam, Cambodia, and the federal states of Micronesia have a varying degree of the ability to respond. So lessons learned. If we go back to your position when you leave APCSS this afternoon and return to your work on Monday, what we have learned in previous engagements is that employ specific country programs, implementation of plans for improvement should be country-led, regional initiatives can be leveraged to improve health security capabilities, bilateral and multilateral partnerships should be used to build health capacity, clearly defined metrics are important to define progress. And this is one of the most important things that I will say during this plenary period, and that is, do not engage in believing you know the answer. Don't think you know the answer to the people you're engaging with. Allow them to be part of the solution, to contribute to the solution sets, and therefore the country Asia-Pacific programs are most important because we address the needs of that particular country and maybe not even the region. So with that, I bid you a fond adieu. We will have a discussion period later, and then we will follow up with seminar. Thank you.